This is a global issue today. Dr. Nagaraja gives a brief insight of the diseases associated with heart attack and stroke.
The heart is the one which pumps blood supply to all the major organs of our body, but the heart itself gets its blood supply through coronary arteries. If those coronary arteries, which are smaller arteries, if they are blocked, then the heart is stunned, it cannot function anymore. And if those circulation is not re-established quickly, that part of the heart muscles which is supplied by that particular artery, there are three arteries going into the heart supply. If one artery is blocked, that particular area supplied by the artery is dead. And that cannot be restored once it is dead. Once it's dead, it's gone. But in a matter of time, within 60 to 120 minutes, if we are able to open up the artery, then the flow will re-establish to that area and we can save that heart cells, heart muscles.
The developed countries have demonstrated that they can handle it more better than developing countries like Papua New Guinea in terms of saving lives of heart patients. According to Dr. Nagaraja, there are two main issues preventing developing countries from effectively helping heart attack and stroke patients.
And what I have seen here is the lack of awareness. Actually, the healthcare is not on the top of the priority for the people, and I think that needs to be changed. That mentality has to be changed, and that will certainly improve the great mortality rates in terms of heart disease. When I say heart disease in the developing world, the cardiovascular disease is the biggest killer, and it is expected in 2020 in developing countries the mortality due to cardiovascular disease, that is heart attack and stroke, is going to be 38 out of 100. That's a big number. That means 38 people out of 100 die of cardiovascular problems.
Technologies have evolved over the years on how effective treatment of heart attack and stroke and other heart-related diseases can be implemented.
Historically, there has been pioneering thing, like we all started off with using a simple drug called heparin, and that actually thins down the blood, but then the chances of saving life was less. And then we started to use clot bursting injections. We started off something called streptokinase, and that was used 2 to 3 decades ago, and we're still in use, and that tries to open up the clot, but it's only successful in 40% of the people. That means 100 people, only 40 gets circulation re-established, 60 people. So science is always tries to improve every day with modern techniques and research process, and they found out a few other drugs, and they tried to improve the outcome with those new drugs, and they were able to reach up to 60 to 70% with those drugs.
But despite the advanced changes in technologies to treat heart diseases, one vital thing still stands as determining factor, and that is timing. Dr. Nagaraja pointed out that dealing with heart attacks is like racing against time for doctors to save lives. And that's the main message that the cardiologists at the Pacific International Hospital would like to bring across to the people.
Heart attack is a race against time. The quicker you are, the better the outcome, because within the first hour of a massive heart attack, 70% of the people die. They don't reach the hospital at all. And the rest of the 30% of the people who manage to reach the hospital will have some degree of morbidity, because even if you try to salvage and open up some of the myocardium, because it has been left a bit too late, the process is already there and some of the heart muscles are dead already. Even though you save the life, but they are left with disability for the life, with heart failures, etc. So you try and save the heart muscles as quick as possible, restoring the blood supply to that muscle. The quicker it is, the better the results. If it is within the first 60 minutes, the better the results.
The Pacific International Hospital is currently the only hospital in the country that has a catheterization laboratory to deal with heart diseases. It also has 3 cardiologists leading a team of other experts. The hospital provides services to heart patients within Papua New Guinea at a cost which is about 3 times less than services provided in the Philippines and about 5 times less than that offered in Australia. The CAT laboratory was established last year, and since then it has been seeing about 12 to 20 heart patients in a month. There are success stories of saving lives of patients of heart attack, but the cardiologists are confident more can be done if patients or people that suffer from heart attack can help also by seeking urgent medical assistance.